Now, COVID continues to dominate the country's health focus, but at what cost? The pandemic has resulted in delays for hundreds of vital appointments, putting lives at risk. And one of them is Wellington man Ewan Ritchie, who was told he'd have to wait 5 months to get a biopsy on a lump on his prostate. So he took out a reverse mortgage to fund the procedure privately, and just as well he did, because it did turn out to be cancer. Ewan Ritchie joins me now. Good morning, Ewan. Thanks for joining us. Firstly, I just want to ask, how are you at the moment? How are you doing?
I feel absolutely fine at the moment. It doesn't physically affect me at all.
That's excellent.
I mean, it's very stressful, obviously, knowing you've got a cancer growing inside you, but, physically I feel fine.
Totally, and the stress will be compounded by these wait times, if I can go over that. So there was 3 months, basically, from you first seeing a doctor to your first MRI. Then you had to wait 7 weeks for the result of that MRI. I presume you assumed in the meantime there was no lump, but there was. Then you were told there was going to be 5 months to wait for a biopsy. So that's almost 10 months before you even know that there is, whether it's cancer or not. What was going through your mind with that wait time?
Well, as I say, it's just gnawing on your mind constantly, knowing that, this thing's there or it may be there, and you kind of really can't get on and live your life because it's just a constant presence, really.
And of course, life is very important to you at the moment. You have some lovely grandchildren. So what was it that made you decide to go private?
Well, I mean, they tell you that early prevention of cancer or early detection of cancer is vital. And I just felt that waiting 6 months from the MRI through to having the biopsy was just taking too much of a risk in my life.
Is this something you expected? Did you ever think that it would take this long to come up with those kinds of answers that are so important for you?
My previous interactions with health, they've looked after me pretty well. But, in this instance, it's just clear that the system either doesn't cope with the volume, and B, it certainly doesn't have the capability compared to what you get when you're in private.
COVID-19 obviously has a lot to answer for, but is there anything that you think could or should be done within the health system to make sure that cancer care stays consistent?
Well, I don't know that you can actually blame my delays on COVID. When I pushed back to the hospital system and said this is unacceptable, their response was, there are a lot of men in the system like you. 4,000 men a year contract prostate cancer in New Zealand, and it's clear that the system's just not set up for them.
So I imagine you've probably given quite a lot of thought to the health system over this time. How do you think it could have better helped you and others in your situation? What would you say to the people who are calling the shots in the sector right now?
I mean, my view would be that because it's the largest killer of men outside of skin cancer, there should be a system like there is for women with breast cancer and cervical cancer. For men, there is absolutely nothing. It's all on the initiative of the male to chase the system to make it work for them.
A reverse mortgage is not an easy decision to take. What kind of stress has that placed on you?
In the end of it, it was kind of like a no-brainer. It's just something we have to do. We've got to sort this bugger out.
Yeah, and you say you're feeling well physically, but do you think the wait has had an impact on your mental health and how you're feeling?
It has to me to an extent, but the worst affected is my wife. My wife lost her first husband and 2 of her brothers, one only a year ago, all to prostate cancer. So for her, it's like a living nightmare. We
you say, prostate cancer is treated differently to breast cancer in New Zealand, but it just seems that the wait times in general seem to be much longer. I'm looking at the NHS in England, which aims for 28 days from referral to finding out you have cancer, and a breast cancer diagnosis, the aim is 14 days. So we're looking at 10 months for you even just to have your biopsy. What is going wrong? What is going wrong? Why are the wait times so long?
Well, to be honest, it's not just the wait time; it's also the procedure as well. First of all, to have on Thursday a PMSA PET scan. That procedure is not available in the public system. That scans my whole body and picks up cancer throughout the body and down to a very minute level. And then the preferred treatment is to have 4 gold specks inserted around the prostate, which then targets the radiation accurately to kill the cancer. That procedure is also not available in the public system. So it's not just volume, it's actually capability and quality of service as well.
You've paid your taxes all your life. Do you feel that the health system has failed you in this instance?
In this instance, definitely, yes. I think it's appalling for men.
Ewan Ritchie, thank you very much for joining us and sharing your story this morning.